We all know alcohol and substance misuse is a problem that affects many people. When you consider the number of people affected, changing those numbers might seem insurmountable, but it's not. As healthcare providers, we are perfectly positioned to do something about it. That's why we all need to be skilled at identifying and addressing risky alcohol and drug use. Wait, aren't these things somebody else's problems? Furthermore, why should we care? First, we should care because alcohol and drug problems are common. Studies have shown the prevalence of substance misuse is higher than what we're currently addressing. Our primary focus here is the 20% of people who are at-risk users. These users include the 1 out of 6 patients you see that has had at least one episode of binge drinking in the past 30 days. 1 out of 12 patients meets the standard diagnostic criteria for an alcohol use disorder, and 1 out of 50 meets those diagnostic criteria for a current drug use disorder, including illicit and prescription drugs. Oh, but I don't have any of those people where I work. Think again. We all see patients who have these problems, even though the problems are often hidden. Why should we care? Because alcohol and drug problems are serious. Alcohol and drug problems cause or complicate a lot of chronic diseases and acute problems. Half of all trauma center visits are alcohol-related, and substance misuse increases an individual's risk of several chronic diseases. Chances are you're already working with these people. Furthermore, alcohol consumption results in over 100,000 deaths each year in the U.S. and ranks third in preventable deaths, following tobacco and poor diet and inactivity. Why should we care? Because alcohol and drug problems are also expensive. Substance abuse is a problem that everybody pays for. Federal and state governments spend at least $373 billion a year on substance abuse. That's $1,486 per person in the U.S. Furthermore, of the total substance-related spending, less than 2% is spent on prevention and treatment, while almost 96% is spent on the collateral damage from alcohol and drug abuse. Shoveling up this wreckage puts a huge strain on the budgets of much-needed programs, including government-funded health care, which must cover most of the burden. This cost is funded by your tax dollars. Okay, so these problems are common, serious, and expensive. So what? There's nothing I can do about them anyway, right? Actually wrong. There are things you and I can do that make a difference. Mosbirt is a proven method for addressing substance misuse in routine medical care. It stands for screening, brief intervention, referral, and treatment. With Mosbirt training, small conversations result in big impacts. The first and most important step is screening for risky behavior. A person doesn't have to be addicted to be in a risky category, and any use of tobacco, illicit drugs, or prescription drug misuse is considered risky. Solid population-based evidence sets low-risk drinking limits for men at no more than 4 drinks in a day and no more than 14 in a week. For women and for men over 65, low-risk limits are no more than 3 drinks in a day and no more than 7 in a week. A lot of people are surprised at how low these limits are, but the science is solid. Anything more than these limits is a positive screen. And with a positive screen, it's time for a brief intervention using motivational interviewing techniques. But that conversation would just be too uncomfortable. My patients would just lie. They'll think I'm accusing them. But the vast majority of patients say,
"My doctor should feel free to ask me how much alcohol I drink."
If my doctor asked, I'd give an honest answer.
If my use affects my health, my doctor should advise me.
Moreover, there's good evidence from many randomized clinical trials that if we just talk with the risky user about cutting down or quitting, 20 to 30% will do it. These conversations also reduce the risk of another ER visit for trauma. As you've seen, most of the time and energy put into substance misuse is responsive, reacting to the physical, social, and economic consequences. Mosbirt is changing all that. Instead of cleaning up the wreckage, we're getting in front of the train and steering it along a safer route. Learning a few simple skills can make these conversations quick and comfortable for you, and more importantly, helpful for the patient. If you are interested in learning more about Mosbirt, please visit this website.